let's talk about the nexus between healthcare and Whole Foods, and that would be your employees.
Mm-hmm.
You have a great healthcare system now. What are the changes that you envision are going to have to take place next year, or this year now?
Well, we've customized our healthcare plan that makes it very affordable. Let me tell you how it works.
Okay.
If you work 30 hours or more at Whole Foods Market, you're automatically covered into our healthcare plan. You're just automatically in it. And it's a high deductible plan, so it's got about a $3,000 deductible. But we supplement that for our team members by paying up to $1,800 into what we call a personal wellness account. This is money that if you don't spend, you can use that for the deductible, or you can use it for things that aren't covered, like dental or vision care or chiropractic or acupuncture, things that might not be a high deductible type of care. And so that's made this plan very affordable, and it's enabled us to cover everybody. 75% of our team members work over 30 hours. That's very, very rare in retail. Mostly it's part-time people that work in retail, and that's so they don't have to provide health care coverage.
And that's increasing now, I think.
Well, one of the concerns that I have is that as the corporations, the system that we've had that's changing is that the states regulated health care. Every state set its own regulations. But corporations like Whole Foods that were self-insured avoided all of those state regulations because we were covered under a different act, the ERISA Act. And we could customize our health care plan for our own team members. And every company could do it a little bit differently. And Whole Foods Market did it deliberately so that we made this high deductible plan that didn't cover certain things like dental or... Yes, but if you got an automobile accident or a disaster occurred to you, you were going to be covered and taken care of. The corporations or the companies or the individuals that were in state-regulated things had much higher health insurance costs than we had to pay because all of these lobbyists would get into the states and they would say, you've got to cover this. You've got to cover in vitro fertilization. For example, in Massachusetts, you've got to cover in vitro fertilization. That raises the cost of every health insurance plan $750. Now, most people don't want in vitro fertilization. They shouldn't have to pay for it. Mm-hmm. But if the government says you must cover that or your plan will not be covered, you have no choice. Whole Foods Market does not cover in vitro fertilization. That's an elective action for people that want to bear children. It's certainly worthwhile. I just don't think it belongs in health insurance. So as the lobbyists line up and they're going to push this to be covered and this to be covered and this to be covered, it's going to drive up the cost of health insurance. That is the reality of what's going to happen over time. And as they tell us we have to cover these things, we'll have to comply, we will cover it, and that's going to raise the cost. That's either going to mean there's less money we have to pay wages to people or other benefits, or Whole Foods will reluctantly start to do what every other business is going to end up doing too, which is we're going to say, yeah, you got to work for our company for a year before you can be full-time. So we'll end up having a greater percentage of part-time people right. in order to keep our costs competitive to everybody else we're having to compete against. So I don't think that's in the best interest of our team members. I don't think that's in the best interest of our society. So I've spoken up about health care. I can tell you it's a thankless task. Got all these people hate my guts. I regret doing it. Just don't really want to talk about health care anymore because I'm tired of being hated by everybody.
Okay, well, I'm not going to ask a follow-up question then.
Thank you.